Hello and welcome to this episode of Live Team TV. In this video I will discuss 11 healings of severe chronic diseases during and after Christian healing prayer. This unique research of Dr. Kruijthoff and the research team in the Netherlands has worldwide never been done before in this way. Definitions: by praying, believers ask God for healing from disease. Healing is a significant improvement in signs and symptoms of the disease, resulting in restoration of health. Medical and experiential findings relating to the individual cases of healing prayer were researched. Data was analyzed and discussed using knowledge of the fields of medicine, theology, philosophy, and phenomenology. The author is a medical practitioner in the Netherlands who was confronted with some remarkable recoveries in his practice, all related to prayer. One of them was also caught up by the media and got a lot of interest. He collected healing prayer reports of 83 cases. After using very strict criteria of inclusion, 27 cases were selected to be evaluated by a team of medical specialists. They researched their medical files, and in 14 cases in-depth interviews were conducted as well. Eventually, 11 cases were considered to be medically remarkable. None medically unexplained, but still very remarkable. All 83 had similar dominance of patterns, instantaneous healings, unexpectedness, strong physical and emotional manifestations, a sense of being touched and overwhelmed, and the cure was not a normal one, but a transformative experience interpreted as an act of God, which changed them in the person as a whole. People called it a healing of mind, soul and body. Let's look at the cases where I will tell you more about the sicknesses, the setting of the prayer, the duration of the healing until the data collection up to 2021, the course of the sickness, the manifestations, the expectation of the patient, and the evaluation of the medical team. So the first one is a female between 35 and 40 years. She had Crohn's disease. This is a type of inflammatory bowel disease, and it causes swelling of the tissues, inflammation, in your digestive tract, which can lead to abdominal pain, severe diarrhea, fatigue, weight loss, and malnutrition. The setting of the prayer was there were 2 prayer healing services 15 years ago. The manifestations during prayer: at the first service she had a sense of being touched in the digestive system and crying. The second service she was falling in the spirit and a sense of being lifted from the floor, levitation, and a wind in the hall. So the course of the sickness was there was instantaneous healing in 2 steps, partial after the first service, but full recovery after the second service, and there was no relapse since 15 years. She had a low expectations of the prayer. The evaluation of the team was that this disease duration of 13 years, so it started 28 years ago, with remissions and exacerbations are common in Crohn's, so they agree it is Crohn's disease. It was considered to be medically remarkable that all symptoms stopped abruptly in a temporal relationship with 2 prayers, and have not recurred since 15 years. A classification unexplained was not given, as up to 20% of patients may have prolonged remissions, but think about it, 15 years without symptoms for this patient. Number 2. This is a male between 35 and 40. He has acute leukemia, complicated by fungal infections, abdominal abscesses, bowel perforation, and the setting of the prayer was an anointing of the sick according to James 5 in a Reformed church 1 year before. The manifestation during the prayer were feeling of support. The course of the sickness was unexpected remission. There was a relapse 1 year later and he passed away, unfortunately, and he had no expectation of the prayer. The team evaluated this case and said he is a terminally ill patient with therapy-resistant acute leukemia and was sent home. He was expected to die within a few days because of ongoing disease with fatal complications. But when at home, there was complete remission. Despite a relapse, the team considered the full physical recovery lasting 1 year to be medically remarkable. Number 3. This is a female between 60 and 65 years. She had multimorbidity and polypharmacy, meaning many sicknesses and many pills, like asthma, chronic arthritis with multiple disabilities, impaired hearing, incontinence, and many more. The setting of the prayer was a desperate personal prayer before she went to sleep 5 years ago. The manifestation during the prayer were strong emotions followed by a sensation of calm and being wrapped in a blanket. The course of the sickness was stepwise improvement of all complaints in a few weeks. No relapse except for reuse of hearing aids recently due to aging. She had no expectancy of the prayer. The evaluation of the team said the use of a variety of powerful and addictive drugs like prednisone, oxygen, she had inhalations, hydrochloroquine, oxycodone, tramadol, fluoxetine was discontinued, and there were no withdrawal symptoms as could be expected. Invalidity turned to self-sustainability. The combination of the above was considered to be medically remarkable. Not unexplained, as audiometry and spirometry were unchanged. To me, this makes it even more remarkable. Number 4. This is a female between 50 and 55. She had advanced, rapidly progressive Parkinson's disease, which is a progressive disorder that affects the nervous system and the parts of the body controlled by the nerves. The disorder may cause tremors, stiffness, or slowing of movement. The setting of the prayer was prayer during an evangelical Easter conference. It's about 9 years ago. The manifestation during the prayer were a warm cloud, thick air sensed by others nearby as well, and a tight net removed from her brain. The course of the sickness was instantaneous improvement, 90% recovery, partial relapse after 8 years, but still very good functioning. She had no expectations of the prayer at all. Evaluation of the team. Instantaneous 90% recovery, regaining full functioning, even back to work from being largely wheelchair bound, with cognitive symptoms and maximum oral treatment with pills. The dot SPECT scanning was still abnormal, 4 years after the healing, so the classification was medically remarkable, not unexplained because of remaining limited symptoms and scan data. Again, this is even more remarkable to me. A scan with all kinds of problems, functionally no problems. Number 5. A female between 25 and 30. She had anorexia nervosa, that's an eating disorder, where her lowest weight was 29 kilograms with a body mass index of 10. Normally it's between 20 and 25. The setting of the prayer was she cried out to God desperately while she was non-religious, and it was 5 years ago. The manifestation during the prayer were a sense of self-acceptance and return of appetite, a bright light and wind in a closed room. The course of the sickness was instantaneous improvement, weight gain from 37 kilograms to 50 kilograms. There was no relapse, and she had no expectation of the prayer at all. Evaluation of the team. There was a sudden healing and subsequent weight gain after 8 years of severe anorexia, with repeated admissions. Body mass index fluctuating between 10 and 20. So this was medically remarkable. Number 6. This was a female between 20 and 25. She had chronic one-sided herpes keratitis, which is a viral infection which remains the leading infectious cause of corneal ulcers and blindness worldwide. Symptoms of this patient were low vision, failed cornea transplantation. The setting of the prayer was prayer healing service where the pastor had a prophecy for her eye. It was 10 years ago. The manifestation during the prayer was a bright light she saw and she fell on the floor. The course of the sickness was there was immediate relief of pain and improvement of vision after prayer. The present situation is unknown because there was no recent contact due to the emigration. She had no expectation of the prayer at all. Evaluation of the team. Repeated episodes of herpetic keratitis of the right eye from the age of 4 years, resulting in chronic pain and low vision. Cornea transplantation was done and rejected. While a second transplantation was planned, all pain and symptoms stopped at the moment of an intercessory prayer. Right-sided vision doubled from before and shortly after prayer. Number 7. This is a male between 45 and 50. He had a type B aortic dissection with severe walking impairment. The setting of the prayer was multiple prayers in a Reformed church, and there was a planning to go to a healing service. This was 18 years ago. Manifestation during the prayer were warm hand on his back and gladness and a urge to walk. The course of the sickness was instantaneous healing, no relapse of complaints. He had a mild expectation of the prayer. The evaluation of the team, he had iatrogenic aortic dissection type B as complication of cardiac catheterization. There was diminished blood flow leading to pain and walking impairment. The instantaneous improvement was considered to be medically remarkable, not unexplained, as MRIs continued to show the dissection with a double lumen, both having flow. Number 8. This was a female between 50 and 55 with multiple sclerosis. The setting of the prayer was different prayers. She was preparing for a healing service 12 years ago. The manifestation during the prayer were none. The course of the sickness was there was instantaneous healing of all disabilities after an afternoon sleep, just before she wanted to go to a healing service, with no relapse in 12 years. She had low expectations of prayer. The evaluation of the team, chronic progressive multiple sclerosis for 7 years, was the course of her sickness. She had an expanded disability status scale score of 6.5 out of 10. This means walking aids were needed, and partly wheelchair bound. Diagnosis was confirmed in 2 different hospitals with corresponding MRI lesions in the brain. Although very remarkable, it was not labeled as unexplained, since the MRI lesions were unchanged. But think about it, this is also even more miraculous, isn't it? Number 9. A female between 30 and 35. She had ulcerative colitis, psoriasis with arthritis and asthma. The setting of the prayer was a prayer healing service with 3 people praying 7 years ago. The manifestation during prayer, warmth, sensation of being held as if claws were removed from her back. The course of the sickness was healed from colitis, arthritis, psoriasis, but not from asthma. The onset was instantaneous and no relapse. She had a high expectation of the prayer. Evaluation of the team. She had a chronic remitting and relapsing course of the sickness. And this was ulcerative colitis lasting 14 years before the healing and psoriasis of the skin, with polyarthritis for 2 or 3 years, which stopped after intercessory prayer. She regained full capacities, even restarting sports. Immunosuppressive medication, TNF-alpha blocker and prednisone were discontinued. Number 10. A female between 30 and 35. She had ulcerative colitis, about to undergo colectomy, and this is an inflammatory bowel disease that causes chronic inflammations and ulcers in the superficial lining of the large intestine, also called the colon. The setting of the prayer was a prayer healing service 7 years ago. The manifestation was there were strong physical sensations, and her husband had a vision before the prayer. The course of the sickness was instantaneous healing, gross reduction of diarrhea episodes, and no relapse in 7 years. She had a mild expectation of the prayer. Evaluation of the team. She had incapacitating diarrhea 40 times daily due to ulcerative colitis. 2 university hospitals had indicated her for total colectomy. Healing was a few days prior to surgery. The operation was cancelled. Not classified as unexplained since ulcerative lesions were still seen on follow-up coloscopy. The last one, number 11, is a male between 50 and 55. He had medication-induced hepatitis, that's an infection of the liver, with vanishing bile duct syndrome. The setting of the prayer was intense prayers by different prayer groups at the same time, 6 years ago. Manifestations during prayer were feeling of calm and lifted from bed at night in hospital, as if a positive power was around. The neighbor in his room also experienced a sensation. The course of the sickness was rapid improvement starting after prayers until full recovery. He had a low expectation of the prayer. Evaluation of the team. He had hepatitis after use of amoxicillin clavulanic acid, evolving into a vanishing bile duct syndrome with impending liver and kidney failure. Liver transplantation was nearby. There was a sudden rapid recovery simultaneous with praying. Although using prednisone bilirubin levels were decreasing unusually fast from the moment on, there was subsequent full recovery.